over the course of last week, as we saw more and more of our public buildings shutting down, including the Eugene Public Library, buses going to limited service, and also really just dealing with the fact that we need to help people do social distancing appropriately, we recognize that there was a need, an immediate need, to create more resources to replace the ones that people normally rely on. So that's why we started working on the shelter option immediately. As of this, I think on Friday was when we really started talking about this in seriousness, and needed to have a goal to get that launched or ready to launch by Sunday night and have all of our plans in place. So we worked over the weekend with our partners to make sure that this could happen, because we were anticipating that Governor Brown would send down the stay home, stay healthy order. And so we wanted to make sure that in order for that order to be observed by people who are unhoused, we had the right places for them to do that.
So what we're doing here at the Memorial Building, and then certainly over the fairgrounds as well, is starting from the ground up and building a shelter almost overnight and utilizing new resources. You know, anytime that you take and set up a congregate living situation, you up the chances for disease transmission. And so we're going into this recognizing that. But we're also recognizing the fact that in order to stave off an illness, you need to be fed properly. You need proper nutrition. You need a good, safe night's sleep. If you don't do those things, your immune system's not going to work right. So we have to balance the consideration of meeting people's basic human needs on a day-to-day basis with disease transmission. And so the solution for right now, and we're going to learn as we go, is limited sheltering, and then really, as we mentioned before, helping people stay in place if at all possible. So I think we share in that concern for the individual's safety and health, and we're doing everything we can to make sure that we protect that.
In this situation, we use CDC guidelines as well as recommendations to the public health department for the 6 feet capacity, and that minimized what we could use for spacing with the beds, which dropped down the number of beds. And so with more spacing, there's less risk, but there's also less beds. And so that's the precautions that we took and put in place for those pad placements upstairs. Down here in other food service areas, we've talked about how, you know, general cleaning and sanitizing the facility, but mostly the service for food is being packaged food brought in, and so there's really low risks for contaminating food when passing it out to individuals.
Our social service partners who do this on a daily basis. We're actively engaging with people with lived experience to hear their concerns, to hear what we can consider, and then we're making their recommendations known and actualized. I think what's super important and what we can ask for is patience from our community. Because we're trying very hard to make use of what resources are currently available in the short term, and then looking for long-term, more robust solutions going forward.